What's up, everybody? How are you? Happy coming off Memorial Weekend. I hope you all had a wonderful weekend. And I sure did. I spent it with a lot of family and close friends. And I apologize. I didn't get a chance to spend it with these lovely co-hosts of ours together to the max. Of course, you see the sponsors, of course, Soft Illusions, Art Gallery, Deli Arts and Survival Magazine.
Of course, Royal House Restaurant.
Restaurant. Yes. And Reggie Wells Quality Speakers, Mocha. I still support my people, Melba's. And with that being said, let me ask you, how are you? How you doing, my co-host tonight?
I'm wonderful. It's always good to sit next to you.
I love it. I love it.
We live in the same house, but it seems like we have large gaps of time of not seeing each other. So it's nice to see you, Bill Foster.
Hi, nice to meet you. Well, we have the special treat tonight. We have the doctors in the house tonight. Yes. And before we go on, we have Dr. Theresa Mack and her husband, Jason Mack. I'm going to ask them personally, how are they doing? How are you, Theresa, first and foremost? I'll go with you first.
Okay, no, I'm good. I'm feeling pretty good. Had a nice Memorial Day, and so it was great.
Good. That's good. Now we're going to bring in her husband, Mr. Jason, Dr. Jason Mack. And Jason Mack, how are you doing tonight?
I am doing quite well. I have no complaints. Things are smooth. I just finished my evening clinic this evening, and so I'm looking forward to having a chat with your audience, and we'll take it from there.
Good, awesome. So, Dr. Mack, Jason,
I think we should be on first name basis.
Well, we are. So, Jason,
for the show.
Yeah. So, first and foremost, can you just run down your credentials for the audience who are just getting to know you, and let them know your expertise in what you do, please?
Absolutely. I'm a pediatrician. I grew up in Harlem. I went to school in Howard University. I went to undergrad and medical school at Howard University. And I came back and have been practicing in East Harlem for the past, it's going on 35 years. So I did a stint as a program director for residents where I trained residents, but now I'm the OPD director of the Metropolitan Hospital Pediatric Clinic.
Awesome.
Nice.
So for everybody that's chiming in and listening, you can ask any questions you want, but we're going to start off until you ask questions. We're going to ask the doctors, is there any particular thing that they want to talk about specifically? Theresa, I'm going to start with your husband because we were talking firstly in the green room. So, Jason, is there anything that you want to specifically talk about right now until we get any questions, and then we can bring Theresa in and she can chime in on this?
Certainly. So this is the time of year that I like to talk about summer issues. These summer issues are the things that we start seeing about April and May. That specifically, that's allergies. We have a lot of people with the allergic rhinitis, the coughing, the sneezing, and then, of course, on into asthma. Then we should also, this is a spiel that I'm giving several times a day about sun protection and insect protection, insect repellents, and those kinds of things. So I think I'll start off with the allergies because that's what are hitting people hard in the past 2 or 3 weeks. And really, I work in the walk-in clinic here at Met, and so I always have about 6 or 7 patients every day coming in complaining of itchy eyes, sneezing, and it's from the pollen. What are we allergic to? It can be grasses, can be ragweed, it can be different flowers and different things pollinate at different times throughout the month. So you may have allergies, but you may have a particularly bad 2 weeks when the pollen that you're most allergic to is pollinating. But there are treatments. The big thing that people are often coming in is to the itchy eyes, the streaming eyes, trying to decide whether it's a pink eye or is it allergies. Uh, there are a couple of things that I do mention to parents is that the eyes can be so red and teary and dreary. Sometimes even looks like there's mucus coming from the eyes when it's allergies. That sometimes people think it's a pink eye, need to get antibiotics for it.
Mhm.
But we tend to hold off on antibiotics unless we really think it's been infected. Uh, uh, if we can treat it with the allergy symptoms, and remember, a lot of times these kids will wake up with their eyes stuck together because they're just streaming all of this gooey stuff, and it looks really bad. They say that's got to be an infection, but it doesn't really have to be.
So excuse me, let me interject. I mean, from old school, we used to call it sleep. So what is it now? What is it? What would that gooey stuff be?
Oh, so the when you say, yeah, when you, it's exactly, we can still call it sleep. It's just that when you have a lot of tear production and your eyes are watery and stuff like that, and then you keep them closed, it'll be a lot of sleep. So you have a lot of crusting around the eyes, and this can all be from allergies. And parents will come in and they'll clean it up, and they'll say, and they'll show me a picture, and they said, "This is what it looked like this morning." But that's generally not an infection because you can't clean up a pink eye. A pink eye, when you have a real pink eye that you need antibiotic drops for, that won't clean up, so that you got to show me a picture about how bad it was before. And so there's drops for those, and they've improved a lot, the drops and the medicines that they use for the allergic rhinitis and the allergic conjunctivitis. So that's a lot better. The other thing I remind people is that the pollen that you're allergic to is not the stuff that's streaming through the air that you can see in the air. The pollen that you're allergic to is the stuff that's stuck to the cars. It's sticky, and it sticks to your hands. And so sometimes that's part of the problem when the kids get into this kind of cycle where their eyes itch and they put their fingers to the eyes, but the eyes have pollen in it. So they just put more pollen in it. Now you're stuck in a cycle. So whatever drops and every other medicines that you use, part of it is to wash your hands and face. You got to get all of that pollen off to sort of break the cycle. When you're dealing with the high pollen count.
It's everywhere. It is. I mean, just as an adult, it's hard to get rid of it, I'll say. One thing I heard you mention, Jason, and you reminded me of something last year. I tend to get sinus infections.
Right.
And so this has been for years. So I went to a walk-in clinic. I felt like it was unbearable at that point. And I remember them telling me that it had not been 10 days. So they would not give me an antibiotic because it had not been 10 days. You were with me that day. And I was like, okay, I gotta suffer a little longer.
Yeah, well, it's true because sometimes the congestion is all part of it. Everything swells up and you feel the pressure, and again, this the same decision: is this an infection or is this not an infection? And it's true even for myself. When I get that sinus pressure, I try to wait to see if I'm going to be able to clear it out. So sometimes we use the nasal spray, the steroid nasal spray. So sometimes that's what you're going to do, is to shrink those tissues, and then the symptoms improve. And if the symptoms improve with that, then maybe you really don't need the antibiotics. There is a push to say, because if we overuse the antibiotics, then the antibiotics stop working because the bugs get so used to seeing it that they're resistant to it. So
they're like, oh, it's just amoxicillin, you're fine. I'm still going to bother you. Right?
So let me ask both of you. I have a question for you later after this, but I'll ask you, Theresa, then Jason come in. What do you suggest for people with allergies? What are some of the preventive things that they can do that can help alleviate the irritation. I guess if that's the best word I can say for allergies. I'll start with you, Theresa, and I'll let you finish off, Jason. Go ahead.
Okay, and we had mentioned this once before. Um, there are, and Malika can bring that part in with the teas and the alternative that she uses. We like to use Benadryl, but you have to be careful with Benadryl because that can make you sleepy. And we also use any of the three allergy medicines. They call them Zyrtec, Claritin, and Allegra. And sometimes when you take those first thing in the morning, it works. But you can get resistant to that. And so you may need to change. So if Zyrtec worked for you last season, it's not working for you this season, you should change. Um, and again, going out, you might need to wear a mask so that you're not inhaling those sticky things. And when you are walking just outdoors, um, you sometimes just will start to cough and have watery eyes, and you don't realize that it is because of those allergens.
Let me ask you a question, Theresa. You said something very important, though. You said something may not work. So is it fair to say that what medicine you took last year may not be effective this year? Could that?
That's correct.
Okay. Okay.
And so one of the things that we do when they come in, they've already tried what they had last year. And so you can offer them another one. They said, but it doesn't work because it's the same class, but it may work. And so we constantly use that as part of our treatment plan.
So
I was just going to say one thing about masks, Theresa. I heard you mention wearing a mask.
Mm-hmm.
I did notice that during COVID, we're all the heightened era of COVID. We all had our mask on, and my mom pointed that out to me one day. That we're effective with the sinus allergy, symptoms. Didn't get that at all. I guess because we were walking around with masks. So it's a trade-off. So.
And I actually think we took the mask mandates off too soon. And so again, when I caution my patients, when you're going into a crowded area or you're even going into a restaurant that you don't know all the people, you should wear a mask just to protect yourself. COVID is still here. And, we just need to be mindful of that.
Yeah, Jason, do you want to add on to what your lovely wife was just talking about?
Yes, all of those things are very important. Other things I've mentioned, just some like if you're in the house, you want to, as far as you can, keep the window shut because you're keeping the pollen out. You're going to use because if you have air conditioning, for instance, if you're in the car and you have the air conditioner all in your car, you want to put it on recirculate so that it's recirculating the air. Otherwise, it's pulling the air from outside, it's pulling the pollen into you. Or just washing, if you have a pet, the pollen gets in there first, or you wash your pets if they go outside. Sometimes it might be just like we did for COVID. If we were all stepping in the house and taking off our clothes and putting them to wash. If you suffer from bad allergies, these are all things I always recommend that if you come in, especially if you've been sweating, you come in, you immediately take a shower, change your clothes so that you get all of that pollen off of you. Because otherwise you're just continuing to inoculate yourself. In the terms of the medicines, we didn't mention the steroids, right? We also use the steroid spray for the nose, which is now over the counter. You used to only could get it through a prescription, but now the Flonase is over the counter.
Right. Everybody, this is Real Talk Chronicles. I'm with all my co-hosts. I'm with Malika Foster, Dr. Theresa Mack, her husband, Dr. Jason Mack. This is Real Talk Chronicles with the Macks. And, if you have any questions, please chime in. I have one question. And for those that are watching, please subscribe to it via YouTube or share it via Facebook or however you're watching it. I have a question. We mentioned, so I think one of you mentioned pink eye. Can you just, for Jason or Theresa, whomever wants to go first, can you tell people actually what is pink eye?
Mm-hmm.
So pink eye is an infection of the conjunctiva. It's conjunctivitis. So it's infection of the conjunctiva. That's the pink part of your eye that you see here. And that infection can be with a virus, and it can be with a bacteria. And it's that bacterial infection where you need to get the antibiotic drops. So we don't take cultures. So we're very often left to try to decide, looking at the eyes, whether it's a viral infection, which is going to clear up on its own, or whether it's a bacterial infection where you need to get antibiotic drops. And sometimes it's difficult to tell. When they have done studies, their studies have shown that usually the conjunctivitis is a viral infection. So the eye doctors are known for, they shake their fingers at us, the pediatricians, and say, you guys use too many antibiotic eye drops on all these pink eyes. And they're probably right. I do. I because when you're dealing with the mom and the kid, and they got to go back to school, and all of this stuff, sometimes I end up giving those antibiotic drops if I have any doubt.
You know what's so funny? I'm glad you said that. And Theresa, I don't know if you want to chime in on this, or Jason, you can piggyback off yourself. How important is it for people to have hygiene and wash their hands? Especially, we all know about COVID and stuff right now, but just periodically, period, especially with pink eye and any things like that. Because I know as a pediatrician, what my parents used to always say, don't touch this. If you're on the train, use this part of your home. Don't touch that. Every time you come in the house, wash your hands. Is that a lost art from a doctor standpoint? And I'll start with you, Theresa, and Jason finish off with that.
No, it's not a lost art. And most hospitals and doctors' offices, you have to wash your hands before you go in to see a patient and when you leave, because you're having germs. And so that can take a toll on your skin. So you have to be very careful, like the types of soaps that you use, and not all the time of the sanitizer. But it is not a lost art, and it is one of the requirements for hospitals and doctors' offices to practice. That if they don't do that, then it's considered a failure. The other thing about washing your hands is not quick. You really got to lather up and
hand over hand, correct?
Right. And
right, or counting something.
You have to do the happy birthday song until you finish. That's how long it takes to get your hands clean. And for patients, it's a big deal, and this is a good forum to talk about it, because when you come in with a pink eye and I start telling you about, okay, now you got to wash your hands, I'm not throwing shade, I'm not casting aspersions, I'm just saying you don't want to catch this yourself, you don't want to spread it around. Now is the time to be very mindful. And I think I've seen a lot of improvement. I see patients. I was in a restaurant the other day when one of the customers came in and said, "Do you have hand sanitizer? Can I have hand sanitizer?" And that was all since COVID. Since COVID, everybody is a lot more cognizant about, okay, I want to clean my hands. I want, and so that's not a bad thing.
No, good.
And also the other thing is, if you're not washing your hands, you have to wear gloves, and a new set of gloves. When you go into a patient's room, you have on gloves. When you leave, you take those gloves out. When you go into another room, you're doing the same thing so that the patient can see that you are. A lot of patients are looking at you to see, well, where was she, and is it safe? And so you do a combination of both.
Yeah, Stefan.
Oh gosh, there's a comment. I can see the comments now.
Yeah, I saw that comment, Stefania. I am so with you, girl. About people not bathing.
Jay, can you see it?
Yeah, I can see. Yeah.
Yes, I don't get it.
Yeah, we need to talk about hygiene and just its totality. Like, you know, Angie, she says, yeah, we are taught that we should wash our hands. Good, you know what I mean?
You know, just think about hand washing. You know, when I worked in the office every day, and you use the restroom, you can hear people, women who just flush that toilet and they just go
run out.
So, I mean, even before COVID, I'm like pulling my sleeve, you know, to open the handle or using a tissue.
We still do it to this day.
I have always done that, and I do it even more so. I just, as you can tell, I'm like, it's disgusting, you know. And even like on the highway, we look over in the car and we'll see somebody, you know, picking it up. It's just all kinds of stuff.
You filthy animal.
Yeah. It makes you want to honk at them and say, "Get out of there."
I think we did one time. I was like,
tissue.
They was driving. I was like, thinking their nose. I was like, and they looked. I was like,
oh,
filthy germ.
It's awful.
You know, everybody. This is Real Talk Chronicles. These are Dr. Macks. They are in the building. This is their show with my co-host. Oh, they're my co-host, but this is my co-host right next to me. And you know what's so funny? This is a married show. Oh, I just thought about that.
It's funny you said that, Bill, because I sure enough was going to ask the story of how the two of you met before we got off. Can we talk about that now?
Yeah, I think I'm
curious.
Jay, you want to tell them?
Well,
Jay, be careful, because if you don't remember, if you don't say it verbatim, you'll be talking about you sleeping.
No. This is a standard story. We met twice. We met for the first time twice. Once when we were interns, and we were both working at a different hospital, and we were rotating. We would see each other on call, and we met then. And actually, there was one of the staff at that hospital, it was Westchester Medical Center. There was a staff at that hospital who we both believe was trying to set us up. We didn't meet.
First intern.
Yeah, and so we didn't meet that at that point. But then 3 years later, we met at another hospital, and that's when our relationship began. So that's why we tend to tell people that we met for the first time twice.
So Jay, who made the first move? Was it you or was it Theresa?
So how did that work, Mommy?
Yeah, okay.
I think it was me. I grabbed it. I said, okay, so we're gonna have lunch, because now by the second time we met, we were both sort of senior. I was a chief resident. She was a fellow doing her nephrology fellowship. So we weren't the interns that were harried and running around. So both of us had a little bit more confidence, I think. And so yeah, we met up and we went to a museum. We went to an art exhibit that first time over on Fifth Avenue.
Yeah.
Very nice.
And the other thing is, I remember, and that what I liked about Jason, he's very sarcastic in a nice way, and you have to listen. You have to listen, and then you start cracking up. Wait a minute, did he say that? But the other thing I really liked about him, we both loved to read, and so I was always a mystery buff. And he reads everything. And so he said to me, yeah, we were talking about reading, and he said, yeah, when I want to, just, knock it down, to, little stuff, I'll read Rex Stout. And I'm like, I love that guy.
Jason, you knew what you was doing.
He
You
has some
slick
more
rascal.
cool points, huh?
Yeah.
Oh well. So we always liked. I liked mysteries. He'll read anything. I have now tried to broaden my horizons. But when we were at the same hospital, when I came, it was an orientation, and I saw him. He was the chief resident, and they had all of the disciplines welcome us. And so I said, "Oh my God, I know this guy." So I go up to him and I say, "Do you remember me from, when we were interns?" And he said, "Oh yeah, yeah. How you doing? Let's have coffee." And I'm like, "Okay." And then he would tease me because, as he said, we weren't seniors. We weren't interns. And when you are an intern, you have to do everything. I mean, it's grueling. You're taking the patient's blood, you're transporting them, you're doing a lot of duties that they hire other people to do. And so, of course, he was chief resident. I'd see him in the elevator and he would just be as calm and collected. And here I am running around like an intern. And he was like, "Oh, you should get an intern." And I'm like, "Leave me alone."
Absolutely.
I already feel bad.
Listen, you know what's so funny? You said you like mystery. I'm a mystery buff. I'm a big James Patterson fan. This is the one I'm reading right now.
Okay. Which
Circle
I
of
can't
Death.
see.
Circle of Death, James Patterson.
Yes.
Oh, okay.
Right,
No, I
and
read a lot of his, and he has a lot of co-authors
Yes.
that he writes with.
So you're gonna tell me about that, and then I'm reading this one too, The Reckoning.
Oh, Catherine Coulter. Okay.
Yes.
All right.
So, yeah, that's so. Listen.
So wait, can we talk about when you thought you lost the reckoning?
Oh, I lost my mind. But anybody, this is a real fun fact, but it's not a fun fact. One of my pet peeves is feeling like I lost something, so I go into a panic attack.
I mean, everyone
And not
is
panic.
losing something, but this one, it's like the skies are parting. The world's coming to an end. Like, we all hate to lose something,
Listen,
but it's like,
the day is not going.
Where's my? I'm like,
The
I don't
day
even
is
like
not
mystery,
going to go on until I find out what I lost. I will cancel all appointments, meetings, phone calls until I find exactly what it is that I lost, and then my day can go smoothly.
So, Theresa, let me tell you something. You know, being the loving wife that I am,
Mm-hmm.
I went on Amazon. And I'm like, let me order this book for him because I have no idea where the book is, right? So you said the book is The Reckoning. You know, I went with the first Reckoning book that I saw, and I'm like asking him about the color of the cover of the book. He's like, yeah, I think that's it. So I ordered the book. It came because Bill was in New York. You know, I was down home here, and I showed up with the book, and you took it and smiled and said thank you. But I looked later in the car, like underneath the seat on the passenger side. His original book was tucked down in there. I guess he thought he was going to read at some point one day when I was driving. So now he has, so now he has two books called The Reckoning by two different authors.
Oh, by two different.
It wasn't even the same one.
No,
it wasn't, but it was the thought that counted, right?
Yeah, it was a beautiful thing. It was beautiful gesture because she knows, like I said, I'll go frantic and I'm like, ah! But you know what's so funny? That's one thing that could segue into our next topic. Everybody, this is Real Talk Chronicles. We're with the Max and Malika Bill Foster. And I'm sorry, I don't.
That's okay. I have a lot of names.
Yeah. But the thing is, let's talk about stress and strokes. I just have a friend that right now just found out he was in the hospital. Right before the show, I found out, I was telling Jason, found out that he's, I posted a picture of him and I today, and I just kind of found out another friend of ours in the picture called me and said, "Oh, did you know he had a stroke?" I won't divulge his name right now because I don't know where he's at with that. But let's talk about stress. Can stress lead to stroke? Because we put so much on our shoulders. And everybody, excuse me, let me just, if you have any questions, please ask the doctor. The bottom line is the doctors are going to talk about what they can talk about in any way they can in their expertise. But we're going to take this all the way until 8 o'clock. And if you don't have any questions, but stress is real and a stroke is real. Can a stress lead to a stroke? And I'll start with you, Theresa, and then Jason chime in.
Yes, stress can lead to a stroke. You have to understand that stress can come in many forms, and it's how you and your body react to it. So stress, I always say, being a Black person in America, you've ex, you've experienced stress, and you have to know how to cope with it. But why you say, can stress cause a stroke? Stress can cause anything because it's your body overreacting to something. And so, if this, for example, if you're stressed about something, whether it's bills, whether it's racism, where you don't have enough food or clothes, any of those social determinants of health, your body is dealing with that. And so, a lot of ways that stress is manifested is through the blood pressure. And so you can get high blood pressure just from thinking of all of those things that are stressful. And so we're realizing that in medicine, and primary care, we're realizing that we have to address the stress. If it's a therapist you need to talk to, or a family friend, you need to do that so that that will decrease the stress. It can also, because when you're having this stress like this, your body is releasing all of these chemicals that could raise your blood pressure, and all of that high blood pressure can cause your kidneys to fail, can cause your brain, the blood vessels to rupture, and you can have a stroke, you can have a heart attack, you can have kidney failure, you can even have leg clots because of the stress. So it is important to figure out and talk with your primary care doctors about stress. And we're now asking questions when you come in. I don't just want to just go straight to the problem. I know it's a diabetic and hypertension, but you sit down and try to have a conversation. And that's why I like this particular show, because you said this was the living room with Dr. Mack. And so that's what I tried to have.
That's the title from now on. That's the title from now on.
That's what I try to have with my patients, trying to understand what they're going through, and then I can turn it around to, oh, well, that might be a part of an issue that we need to address. So it is very important, and we're under so much stress that just living in America. That we don't really realize it. That's why everyone needs to make sure that they have a primary care doctor who cares and understands about them, so that you can be proactive and prevent a lot of these things that are happening.
Yeah.
So what are some signs of stress? Because I think some people are under a lot of stress and may not even realize it.
Mm-hmm.
So what are some signs or symptoms of stress that we can tell our audience to look out for?
Well, you're too busy to relax. You're running from place to place. If I ask you, how do you going to work, you're picking up your daughter, you're coming home, you're cooking, how do you relax? And they don't know what that means. So even though you have to, you're doing a lot of things, you still have to take some time um, for you, even if it's sitting down and reading one page of something that you like to do, or doing music. And so I'm trying to think of other concrete examples. Um,
Other things like sleep,
okay.
sleep disturbance. If there are people who just that you wake up at 2 o'clock every morning, can't get back to sleep. You're staring at the ceiling. Also, people who
Hey,
short
Hey, Jason, I just thought that was
temper.
because you're getting older now. You can't go back after the bathroom, but just a little icebreaker. But go ahead, please continue. You're right. I mean, what's so funny, and I want you to continue. I apologize. We have to understand that there's a culmination of things that can cause stress. Relationships. I just got off the phone today with a friend of mine that called me about a family issue. Bills, everything. And Jason, continue, but one thing leads to another. It's like the ear bone connected to the elbow, the elbow, and the elbow connected to the arm. You know what I'm saying? Whatever that song was, I forgot it.
Yeah.
Yeah, please.
And you're right. All of these things play a part. The kinds of things that sometimes help with stress is also having a routine. If you can have a routine, then you're not, that can be stressful in itself, that every day you're just taking it as it comes and you're just responding. And if you're always in response mode, then you can't sort of set your thing. So you have a routine, even if it's that I get up, I stretch in the mornings, just having that routine sort of helps you set your day, and that can alleviate a lot of stress.
Work stress, biggie.
Mm-hmm.
That snuck up on me so bad.
That's what culminated this relationship between us because of stress. You know what I'm saying?
Yeah, it snuck up. Bill and I had just gotten married a couple months prior. Our home, we were displaced, for a renovation, which was like mad chaos. And work, I mean, it's always been stressful, but at that period of time, it was through the roof stressful.
Yeah.
And it snuck up on me and just like punched me in the back, like it hit me hard.
You said something interesting is because we always talk about stressors and we always talk about the bad things that are stressors. So like I lost my job, I got a divorce, those are stressors, but also the good things are stressors too. I got a raise, I got a new job, I got married. This was a change that you now have to adjust to. It's a stressor. Even though it's a good thing, it's something that adds to a stress. So sometimes just being aware that is something that you have to deal with can help you to understand that, that's why I'm a little bit edgy, because I'm out of my routine.
Right. I love what you just said there, Jason, because when you think about it, it's like, oh, of course I was over the moon ecstatic with, getting married and always grateful for having a home, being displaced or not, to another apartment. And of course, having a job, especially a good paying job, those are all good things. Yeah. So I like the angle that you just came from. So it wasn't like they weren't negative things, that was happening, but it was so many different things on top of a few others that hit me. And I'm sure other people as well. Like I heard stories of people at that same company, who had heart attacks. There were, I think, 2 or 3 people, not in that direct office, but, not too far removed, who had a heart attack from the stress of work. There was another story I heard of a man who it hit him so hard that he was at work, and I guess his back spazzed or whatever it was. He couldn't stand up out of the chair, and they had to carry him out. I don't know if this story is true, but I think it was. They carried the chair to get him out of the office and, get him some help. It hits people hard, and they don't realize it at first.
People deal with stress differently. I mean, people sometimes enhance their vices. Some people can, from a machismo standpoint, I know me, when I have a culmination of things that are coming at me, the macho, depending on the era that we were raised in and brought up in, like men are not supposed to be weak. So, you pick on that thing and you go farther and farther, but it still takes a toll on the body and the mind. And it also can make, in relationship aspect, it can make a shortcoming in a relationship, because Malika could want to, and I'm just using Malika as an example at this point.
She think I'm just kidding.
She could want to talk about something, and I'd be like, yo, I got other stuff on my mind right now. I'm not trying to hear about, what you're saying. So people, I guess the moral of my story, and the doctors can chime in whenever they feel free, is that, people always say, Bill, you look young for your age. I was like, yeah, because I said I live a stress-free life. I don't let it. I'm that duck. I'm gonna let it go off my back.
Is that why I have all this gray hair up here? Because I have a stress.
That ain't because of me.
Now I know.
Nah, you ain't gonna blame me on that there dog face.
No, but yeah, people handle it differently, and I'm still work in progress, I will admit, but I have implemented certain things to make me slow down, because I'm just one of those, oh yeah, I'll say yeah, or Bill needs something, he wants it right away, and it's like, I can't, I'm in the middle of something right now. Get it down. He doesn't want to hear that. So yeah, it's about finding. That's a true story, Theresa. Yeah.
I gotta give a shout out to my partner in Row House, Sherry Wilson.
Hey, Sherry.
She's chiming in. So, Sherry, you stressing me out. Let me stop that. It's good to see you in here. Everybody, come and support Row House. Come and see it. Shout out to everybody that's chiming in. We appreciate you. This is the living room with the Max. Dr. Mack. That's the name. Theresa, that's the name. We're not going anywhere else. It's Living Room with Max. My co-host Malika Foster. Listen, if you like the content, share it. We're talking about stress, any medical issues and things that you want to chime in on, please ask the doctors. Right now, we're talking about stress and strokes. So, who was it? Jason, are you going to chime in? Go ahead, please.
Yeah, so I think the other thing I'm just seeing the comment about breathing exercises, and those, it's always hard to fathom how breathing. I breathe all the time, but having the exercises where you're taught to breathe and have controlled breathing and pay attention to your breathe, being mindful of that, sort of helps you to take you out of the just being buffeted from place to place, gives you that modicum of control and mannerism. So I don't discount the breathing exercises. Those are very important. In fact, they have the little apps now. The Calm is the app that if you can program it, that at certain times throughout the day, a big gong will go off to sort of remind you to take your breath, follow it and stuff like that, so that so they have it programmed in. There are a lot of things that they're teaching us about how to be mindful, to alleviate your stress, and I think those are important.
Exercise is huge. Taking walks, like when I worked in the office, it was a lot of people would smoke, and so they would go down and take their smoke breaks. And so I started to just go down, even though I didn't smoke, I would just go down and, walk around the block or just stand outside away from the smokers, but stand outside just to get some air. It's a biggie. So, Joyce actually mentioned yoga. Up there it is. Yeah, yoga is another good way of de-stressing. Took me a while to get there, but I love it now. Have you ever tried hot yoga, Joyce? We tried that on 145th Street. Yeah. I loved it. I would definitely. Would you do it again?
Oh, absolutely.
Yeah, I would definitely do that again.
Absolutely.
Yeah. Have you tried it, Theresa? The hot yoga?
Yes.
It was too hot.
No. We were going to one on 116th Street. Our mutual friend Helen had told us about it. And no, it was very good. I went a few times, but the times that I went, I think were wrong, because when I went, and it was a 90-minute class, you shower, and then I went to work, and I was dehydrated, and it took me a minute. So I am thinking about going back to that 145th, not doing the 90-minute, but yeah,
No. Well, they only have 90 at the 145th.
They don't have 90. Okay.
Yeah, so that's the sad thing about doing hot yoga. You know, they only have 90 minutes. But I'm Theresa, I'm sure you was in there writing prescriptions like, okay, here, get out my face. You know what I'm saying? Because listen.
I can't say it was new to me, so I wasn't really. I would look at people, and they would have all this flexibility, but as you kept doing it, you got better, and so I like that, and it wasn't so hot. I like to be able to sweat, and so it definitely did that.
Absolutely. Yeah, I want to say the room was probably like 100, 104, something like that.
Wow.
It was pretty intense. Jason, you should try it.
She's talking about you should try. We'd be passing out. We'd be running over there. You got 1, 2, 3.
So Joyce said, to be transparent, these hot flashes have been the reason that kept me away, though. Yeah, you may not want to step into that room.
yeah, absolutely. Shout out to my 06 Capricorn sister. Yeah.
They
she mentions that about hot flashes, it makes me think of menopause, and that the hot flashes aren't the main thing. That's what people always talk about. But when you have lots of symptoms with menopause, it's because your estrogen is low, and we didn't realize all the things that it did. But it can be responsible for hair thinning. It could be responsible for insomnia. It could be responsible for leg cramps. And the one that I find that they're calling it, wait a minute, it's genital something of menopause, which means that your mucosal lining in the vagina is so thin because you don't have the estrogen, you're constantly getting urinary tract infections. And so I had patients that were constantly coming in, and I would do the urine culture, and they would have an infection. And I said, well, I'm going to send you to GYN. And between the GYN and the urologist, they said, this is part of menopause. You need to use a cream. So an estrogen cream. So it is not strange to me, because the most people think of menopause as I can't wait to get there because I don't have my monthly cycle. But then there are other things that come.
Don't worry about it.
And Helen is writing, I miss Bikram yoga.
Bikram yoga. Thank you, Helen. That's the name of it.
We would just call it a hot yoga. That shit was hot, Helen.
I know.
Bikram, whatever you want to call it. It was just hot.
Yeah. She says now she's involved in core and body balance and spin. You talk about a beast, a beautiful beast she is. My goodness.
Helen, you stressing me out with all that stuff you're doing.
It's like 5 or 6 days a week, Helen.
Yeah, you stressing me out. Take a day off. Get you a pork chop sandwich.
Oh my God. It shows she looks.
But exercise is a great stress reducer. Okay. You don't need medicine. Sometimes if you do the exercise and eating right, and not eating a lot of processed foods, this also helps.
You see the questions, like doctors?
Yeah. Can someone with hysterectomy have hot flashes? Well, yeah. And yes, go ahead, Jay, and I'll.
Yeah, because as Theresa said, it has to do with loss of the estrogen. So it's the fact that the ovaries are not it's not really, the uterus is not really a part of that.
Okay. Next question, we have, I think, that's a statement from Sabrina. Everybody, this is Real Talk.
Well, there's actually one more up here. Okay. When we switch topics.
Stefania.
Yes. So Stefania says, so a friend of mine works in a hospital and she told her about a patient that has tuberculosis. What are the symptoms and how deadly is it?
Wow.
This is a good question.
Mhm.
And we're seeing more tuberculosis. Um, tuberculosis is an infection. When you get sick with it, the most common way people get sick with it is that it goes to the lungs and gives you an infection of the lungs. And it's a chronic and long term infection. The thing that's important about it, though, is that before it goes to the lungs and makes you sick, you can be exposed to it and it's traveling around in the bloodstream. That's what a lot of our preventive measures are aimed at, is trying to catch that tuberculosis while it's traveling in your bloodstream before it goes to the lungs. So if you know about people where we used to have to do the PPD, now they do a blood test. All of these are to pick up whether you've been exposed to tuberculosis before it goes to the lungs. We have antibiotics to treat it when it's in the lungs, but you can look forward to four different anti-tuberculosis drugs that you're going to have to take for at least 4 to 6 months. So that's we have medicines for it, but it sits in the cavity, and we talked about bacterial resistance. It can become resistant to the different medicines, and you have to kill it by using a bunch of medicines at the same time. Um,
Um,
And there was one of the questions was symptoms. And so it could be cough, it could be bloody in the cough, it could be fever. Um, you're just not feeling right because your body is trying to fight it off, but it needs additional help. And with people coming from different countries, where tuberculosis is running rampant, and it is deadly if you don't have the medication. But we here in the US, we do test for it. And if you come up with a positive test, and that was the PPD test, and now we have another blood test called the quantiferon, we automatically would do a chest x-ray to see if it is in the lungs. And if it is not in the lungs, we say that your own body has fought it off, but it has walled it off. Those white cells have just encapsulated the TB such that you're not sick. But if you ever get sick, and as you get older, or you get another illness, um, those white blood cells that are keeping that TB at bay, they open up. And so then you can get TB at a later stage, which is why we now say that we want to treat the TB, that the chest x-ray or the lungs are negative, but it's still in your bloodstream. We want to treat that so that as you get older, you do not have tuberculosis. And once you have tuberculosis, you never do a PPD test or a skin test again. And you would never do the TB blood test again. It will always be positive.
Let me ask, okay, I was about to ask you why. Why don't you do that test again? Because it always comes
Because
back.
your immune system has memory. Okay, so even though it has you've killed all of the bacteria, your T cells that have memory are still there. And so when you test for it, it's always going to be positive. It's the same way with syphilis. Um, Once you have syphilis, you get treated for it. You're always going to show positivity for syphilis. And we have to remind people that you don't have it now. And the way you do that, you test the amount that reactivity. And so it goes on a 1-to-1, 1-to-4, 1-to-8. That's how the lab would report it out. And so it's a healthy immune system, to show that you even have TB. It's a healthy immune system that let you know that you had positivity for syphilis. Remember, your immune system is fighting infections, fighting things that should not be there, and they're called foreign substances. And so that is what your immune system is fighting. And it's a good thing, but those are diseases that it comes up, and we now have medications to treat.
So this question about asymptomatic, and yes, and that's what Teresa is referring to, is that we call that latent TB, is where it's circulating, your immune system has it under control, and you're not sick. But the key is that you have to fight the TB then, because you think about if your immune system has it under control and is keeping it at bay, but then you get sick with something else and you get weakened or you get stressed out, then your immune system is no longer fighting it. The TB travels to the lungs and makes you sick. So if you are asymptomatic and we do a test and we find that you have TB, we start you on anti-TB meds to kill it before, so that you don't always, it's because it's like a ticking time bomb just sitting there waiting until it can attack you.
Understand that. Steve Meekins has also said that he had tuberculosis.
TB.
Yeah, because I got a little tongue. My tongue got a little fat. Tuberculosis.
Just TB.
TB. It's not gonna beat me. You know what I'm saying? And he had it
when he was 2. I think he said.
He said when he was 2.
And he said he took 2 medicines for 2 years. And that's part of what we mean about the drugs getting resistance, is because now this is an adult. He's talking about when he was 12. So it's about a decade later. Now 2 medicines is not enough if you have full-blown tuberculosis. You were talking about 3 and 4, because we have MDR, multi-drug resistant tuberculosis.
Wow, isn't that something? Everybody, this is Real Talk Chronicles. This is Malika Foster. This is the living room with the Macks. And Sabrina has a question or a comment. What is that?
She said the thyroid effect, it caused, I got mine removed due to thyroid cancer.
Right. So the thyroid is a gland that sits in your neck, and it releases hormones that help in raising your metabolism, so that the foods that you eat can be taken into chemicals that your body can use, or substances, I should say, that your body can use. And so the thyroid, when we're testing, we're actually looking to see about, is it overactive? And that would be hyperthyroid. And those are the people that are always very, very hyper. Sometimes they have the eyes will bulge. They call that the thyroid eye disease. And now they have commercials that say, if you have thyroid, you need to see your eye doctor about that. But that is revving up your your metabolism, so that everything that you eat gets utilized quickly. And so you tend to lose weight. The other one is if the thyroid is not active, or it's below active, or hypoactive. And that means that your body cannot formulate or use the substances from the food, and so you tend to put on weight because your thyroid is not working properly. So those are the 2 things, the hyperthyroid and the hypothyroid. Now, the other thing that we do when you have either one of those conditions, we do a sonogram, and that's just taking It's not invasive. It's just like the sonograms that you have that you get when you're pregnant and you're looking at the baby. But we do that, and what we've been finding a lot of is thyroid nodules. And thyroid nodules may be cancerous, and that's what you are doing different tests to find out. Um, yes, I see a comment. You can have a goiter, which means that the thyroid is enlarged. And there are 4 glands of the thyroid. And sometimes you can pick it up when you're examining. You can put your fingers on 2 sides of the neck, or both sides of the neck, ask the person to swallow, and you can feel the thyroid going down. But sometimes you can actually see it, or the neck looks full, and that's what we give you a hint to a goiter. So the person had made a comment that she had her thyroid removed because of thyroid cancer. And so we classify the nodules, and they have an X-ray appearance that could be cancerous. So if that's the case, the ultrasound will say that, and then you will take either a biopsy, we call it a fine needle aspiration, and you'll see what the substance is, or the pathology, or what the disease is. And if it is cancerous, you remove it. Now, everybody gets cancer is the big C, but I have many patients who have had thyroid cancer, have had it removed, and are doing well. And if they take out all of your thyroid, then you have to take thyroid supplements. If they leave half of it, or they leave one lobe of the 4 glands, then you may not have to take medicine, and that's determined by a blood test.
Understand. Jason, do you want to chime in before we go to another question or statement?
No, I leave thyroid with pediatrics. I don't deal with a lot of thyroid cancer, so I'd leave that to mommy.
All right. All right. Good.
So Kenyatta says, she asked, I'm sorry. He said, how come so many Blacks in the US have vitamin D deficiency?
Mm-hmm.
That's important.
Mm-hmm. Mm-hmm.
That's important. And remember that vitamin D is triggered through the skin. The sunlight on your skin is what converts the vitamin D. And we see people who have very dark complexions, who are dark skinned, may have problems getting enough sun in order to make the conversion of vitamin D. And so we see, especially in the areas at this latitude where we don't have as much sun, we sort of have this sort of vitamin D deficiency belt along this northern latitude that you may not see so much in the southern latitudes of the US, where you have more sun. But the key is the dark skin in response to decreased sunlight exposure.
And another theory that we think is occurring is that the melanin in your skin prevents the conversion of the sunlight to vitamin D. And so that is why we will tell, and if you use sunscreen, that also prevents the sun from getting to the vitamin D. So you have to have a happy medium of the sunscreen, and also not too much sun, because of
well, that's what I was going to ask you, Doc. I mean, and I ask both of you. Everybody says, well, too much sun, you get cancer, So skin cancer. So I mean, what do we do? Like, we ain't got a radius or a scale on it.
So, right, full confession, I have an obsession with the sun. And the beach and just the sun. I'm known to just stay out there for a long periods of time. And my mother, who will be listening to this in the morning, she's going to say, "See, I told you so." She's always telling me to stop, get out.
So the sun, well, there's a couple of things. First, what puts you at risk for the melanoma and the damage is actually being burned and having sunburn. So that's the one thing that we want to avoid. And it's true, dark-skinned people can burn. We don't burn as quickly as fair-skinned people and as people with no melanin, but we can burn. So part of the key is to avoid being burned. What number sunscreen should be used is the question that's there, and generally that number is called the SPF. It's called the sun protection factor, and what it is a multiple of how long it will extend the chances of somebody being burned if they're a fair-skinned white person who would burn in about 30 minutes.
Well, I was just about to ask you that because for our, and I'll say this affectionately with humor, for our fair-skinned people that are watching that have not chimed in, but the bottom line is, we always tease or Caucasians or people, fair-skinned people, like, you need some sun. Like, but how long can they stay in the sun? You'll never get our skin tone, but people like Malika love the sun. I'm like a vampire when it comes to it. I'm like, you know what I'm saying? So I run. So what do you suggest for fair-skinned people?
Yeah. So for fair-skinned people, we tell them that tanning is not healthy. It's because they put themselves at risk for burning and for sun damage. They should be use sun protection. The FPF number should be at least 25, because if you were burning 30 minutes, then the SPF is giving you 25 times that 30 minutes. That's about 12 hours. So that to me means that the higher the number is better, up until you get to about 25 to 30. I don't see a point of having sun protection factor of 50, because what, are you going to protect yourself from 24 hours of sun exposure? No, nobody has 24 hours of sun exposure. So I think there's a little bit of diminishing returns. I do recommend that, for instance, like I said, in this area, in this latitude, we don't have as much sun. So dark-skinned people may not have to worry about sun damage as much. But then when we get on vacation and we go out to the islands and we're loving the sun, that's when you can burn, and you need to pay attention there.
So let me ask you.
So I'm prepared now. I'm prepared. I'm prepared for my day trips to the beach. I bought an umbrella, or I'll rent one, and I also bought one of those little half tents. So I'll hide in there. I'm ready.
But you know what? I get it, but I don't get it. That's like going to a bar and not ordering a drink. Why going to the beach and don't get the sun?
The sound of the waves,
Hogwash.
So I have to tell you, Theresa and Jason. So, when Bill and I first started dating, you go through the whole list. Oh, you like this, don't like that. And I'm like, I love the beach. So we came up with a compromise that Bill would go to the beach with me.
We didn't come up with that.
Well, we did it for a few years.
I signed the papers on that.
He signed the papers.
I didn't come in with it.
That one day out of the summer season, Bill would go with me to the beach.
Okay.
Once I got him there, he was like a little whiny kid on the way there. Oh, he can't find his trunks. I bought him a few pair of trunks. Can't find any of them. So we finally get out, get on the highway on the way there. He's doing all this. We get there, and he's having a blast. He's, watching the seagulls. We're talking about people on the beach. He had a good time.
Well, I'm going to get there and pout for the whole 3 hours.
Yeah.
I got to lose my mind. I'm going to do, listen, if you're going to put me in hell, I'm going to show you how to have fun with heat. You know what I'm saying? But the bottom line is, she knows I don't like the sand. I don't like the
Nobody
beach.
likes sand.
And I'm just sitting there. Seagulls was coming at me. I'm like, yo, you know, you can't even eat something with a seagull looking at you from 5 feet away. I'm like, oh my God. Now, if you want me to get to the beach, and not a beach, a pool, I'll splash around all day with you. But listen, I'm not a beach person. Malika knows. Listen, talk about stress. Let's get back to that. Let me finish this. When she started, when we talked about the thing, when we first started dating, I told her, I said, listen, I'm not a foodie. Keep your girlfriends. If you want to go food, keep your male friends. I don't listen. I know what I don't do, and I know what I do. You know what I'm saying?
I alleviated Bill's stress last summer. Was the first summer that he did not go to the beach with me. I had a ball.
Happily ever after. Now, listen, everybody, this is Real Talk Chronicles. I'm your host, Bill Foster. We're in the living room with the Macks, Theresa Mack and Dr. Jason Mack. Thank you all. We got 4 more minutes. Any more questions or comments that people want to say before we let the doctors go?
I think we're good.
Okay, appreciate y'all sharing. Anything else? Go ahead. What's Kenyatta say what?
It's therapeutic for some people.
God bless. Yeah,
it is. You know, you can just buy me a Tito's.
Oh,
I'm sorry, my bad. Your fault, my mistake. You got to have some icebreakers in here. Listen, you know what I'm saying? Is there anything else we go back up? Everybody, if you like it, please subscribe to it, share it. Listen, got the doctors in the building. You're not going to go any other place. There isn't any podcast that is having doctors give you their expertise in whatever question that you ask, especially their fields. So on behalf of Malika and myself, their family to us, the Max, we appreciate you so much. We're trying to get them. Teresa's on a regular schedule for the most part. And Jason, we're going to get you on one. And we want to get you together. We want you to get you together. You know, we want to get you separately. Because you know what? We can keep you two, Theresa. You know, you a lone wolf.
If you don't mind sharing, Theresa.
And Jason, you can come in when you're available. But Jason, you can go solo. And you got 3 kids that shining. So like I was telling my cousin, Dr. Porter, listen, I'm trying to get her husband on, but he's like that peekaboo, ha 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 ha, back out. So Jason, I appreciate you, Theresa. I appreciate you all. Let me tell you something from the bottom of Malika in my heart. And everybody, please give some hearts for the Max. First you have 2 doctors. Love, black love right there. Give them some hearts. They are serving the community. They are in Harlem.
Bill, I just need to say one thing, because the last time I was on, there was a question that if you had a kidney transplant and you died, could that kidney transplant be used again? And I had
Colin is in here. I think he might have been the one that asked that question.
And I had to query a lot of other nephrologists who said that's an excellent question, but no, the kidney is gone. So I just wanted to do that before we left.
Thank you for following up on that.
I just want to mention that this is such a nice forum where people can to come and talk and it forms a community. So kudos to Bill and Malika for making this possible. I think this is a great thing. God bless you.
Yeah, I mean, before we get out of here, we always end the show with positive affirmations. First and foremost, we definitely giving you two yours. We hope to see you very soon. But the bottom line is with all that's going on in this world today, we like to end on a positive note. And Theresa, I'll start with you with positive affirmation. It could be spiritually, mental, health-wise, anything you want to say, just positive. Give some positive affirmation, and Jason, you can finish it out, and then Malika, you can finish it.
Okay, I think that having just regular exercise and stretching first thing in the morning will be one of the best things that you can do for stress.
Yeah, I think just the family and the community are just very strong among our people, and I think we should look to those and keep that positive energy going, especially during these times when everybody seems to be pushing against that.
So true. I just want to say, it's so important to look out for each other. Each of us have, our own routines and things that we have to do on a daily basis, and some things could be missed. Whether it's, your spouse, your partner, a good friend. We never know what it is that people are dealing with. And sometimes it's okay. A lot of times people just say, "Oh, how you doing?" and they really don't want to hear the answer. But maybe it's okay to slow down just a little bit and really look that person in the eyes and say, how are you? How are things? And just take a moment. It can go a long way.
Yeah, I'm so appreciative of you two for being in our lives, and I hope you appreciate us being in your lives. But let me tell you something. We always talk about how when Malika got caught up with that high blood pressure, Theresa, you was
on it.
Yeah, they said Timmy Cricket on the spot, and Jason, I know you was right behind us.
Yes.
And we just appreciate you. Anything the Fosters can do for you, it is just it's a phone call away. For my people out there watching, please share and subscribe to this. Support the doctors. Doctors, I don't know if you are taking new patients. You both are in the New York City, the metropolitan area. Theresa, I think you said last time you will take new patients. You can tell them again. And Jason, you can
Yes, and actually, I did get one from the show. Okay, came to the office, and yeah, so it was great. Okay.
Good. Jason, I know people out here making babies left and right.
That's right. Yeah, I'm taking them all. Just make sure you're under 21.
Yeah. There's a lot of grandparents out here that probably need to, grandparents out here that are probably watching that they need to tell their grandkids to go, their children to take them to you all. Where are you practicing that, Jason, if you don't mind telling people?
I'm at Metropolitan Hospital. That's in East Harlem and 97th and First Avenue. And I've been here for 35 years. He's
a boss. He's a boss. Yeah. Everybody, this is the living room with the Max. This is Malika Foster. I'm Bill Foster. Row House, Melba's, Chocolat, Deadly Arts of Survival Magazine, Soft Illusions Art Gallery. Right?
That's right.
Real Talk Chronicles. Everybody have a wonderful, wonderful evening. We'll see you next month.
Yes, sir.
Okay. All right.
Great.
Thanks, everybody.
All right.
Be well, guys. Bye-bye.
Bye-bye.